I'm Rich Noonan for World Business Watch, a program in which we look at businesses that are changing our world. Today, a story that could actually save your life. If you've struggled with your weight, which most Americans have, pay close attention to this program. This is a story of one of the leaders in bariatric surgery. Garden State Bariatrics is a practice that is serving much of the Northeast with offices in Millburn, New Jersey and Bayville, New Jersey. But it is changing lives in a very powerful way all over the place. This is a story of hope for people who have a very serious health problem, obesity. People like Tom, who plays Santa Claus at Christmas, or Liv, the 25-year-old who loves to go out with her friends, or Karen, who fights back tears whenever she talks about getting healthy for her little boys. These are the faces of obesity, people just like you and I, whose lives are very different today because they found the answer to their weight problems, and more importantly, their health problems. They picked up the phone, made an appointment with Garden State Bariatrics, and recaptured their lives. And you can too. Garden State Bariatrics has a big footprint with offices in Millburn and Bayville, New Jersey. Grab a pen. We will give you the website and phone number frequently throughout this program so you can call and schedule your consultation. Begin the process of reclaiming your health, your body, and renewing your life. Many people think that bariatric surgery is only for really huge people. It is not. Take a look at this holiday party with about 500 people in attendance. Many of them have had bariatric surgery, and many of them thought that they had to be really huge before they went in for that surgery. It's just not true. In fact, you might be surprised to know that you are clinically obese. Many of these people were, and they didn't know it until they visited Garden State Bariatrics. Doctors Michael Biloff and Basil Yersizian see it every single day. They are lifesavers on the cutting edge of bariatric surgery, which is now a very safe and very effective medical procedure. The doctors and their team at Garden State Bariatrics change lives every single day. Tom Pearson says his life was saved at Garden State Bariatrics. Tom is a great guy who loves his life on the water in Bayville, New Jersey. He's known to everyone as Santa because he's one of the most sought-after Santa's helpers in this part of America. He's a great Santa, but behind the smile, there was a man who was suffering. Tom lost his wife Peggy to cancer several years ago and found comfort in food, lots of food. Tom was raising 3 children alone, and his weight began climbing to almost 400 pounds. As the weight climbed, his health declined.
I was on about 15 different medications, just kept trying this one and that one and going up. Different illnesses would come on. My breathing was bad. They thought a couple times I was having a heart attack, but it really wasn't that. It was just the stress of the weight. And I would get down to, I could never break 300, 310. I would try to lose, and then I'd get discouraged and, why bother? And I went in March of '09 for a sleep apnea test. They wanted to take my driver's license. I went back to my family doctor, Dr. Frank Alario, and I said, Frank, I said, I can't do this. I said, you got to hide the report. What can I do? And a year earlier, it sent me up to see Dr. Beloff. I talked to him. I was afraid of the commitment. Could I stop eating? I've always been a gavone. How can I deal with this? When they were going to take my driver's license, I said I had no choices.
His doctors referred him to Garden State Bariatrics, but like a lot of people, Tom had lots of misconceptions about bariatric surgery. He thought it was dangerous. He thought he'd never be able to eat normal food again. It would be painful. Insurance probably wouldn't cover it. All untrue. Let's address the most important issue first. Is bariatric surgery safe?
The surgery itself is quite safe. Actually, 2 years ago, the New England Journal of Medicine did a rather extensive study about this. A couple thousand patients, multiple centers, et cetera, and essentially, without getting technical, came to the conclusion that the surgery is essentially equivalent to having your gallbladder removed and safer than having a hip replacement surgery.
Most insurance plans cover bariatric surgery. Garden State's team members are experts in dealing with patients' insurers. Give them your insurance card and they will check for you, but every patient we interviewed said their insurance covered the procedure. Garden State Bariatrics has been designated a Center of Excellence by the American Society of Metabolic and Bariatric Surgery. Earning a Center of Excellence designation is not easy.
Certain places that do bariatric surgery as greater than 50% of their practice and maintain certain volume numbers throughout the year And they perform those operations at centers of excellence where the hospital staff, the nursing staff, the people who are working with the patients in the clinic all know how to take care of this patient population. So as a result, the safety profile of the operation has exploded exponentially.
In fact, Tom and every other Garden State patient we spoke with said recovery from the procedure was easier than they expected. Tom was pleasantly surprised that after his bariatric surgery, he could still eat great food and, most importantly, have a new life.
Instead of getting the 32-ounce prime rib, now I get the queen cut, and I get 4 meals out of a queen cut.
We met one person after another who said the same thing about Garden State Bariatrics. You might be wondering, what is bariatric surgery? Well, it's changed significantly over the years. At Garden State, there are 3 different options available. They will help you figure out which one is right for you.
The gastric bypass, the gastric sleeve, and the gastric band are the 3 operations.
All of these procedures are usually done laparoscopically, which means no big open operation like the old days. Surgeons make small incisions and do their work.
In comparison to the open surgery, it's much less pain, much quicker return to work and back to normal activity. And we have patients who, as early as a week out, are doing their activity is back to normal, and they're doing their exercise towards a healthier life and losing weight, the things that we ask them to do.
Many Garden State patients are surprised at how fast they can get back to work after surgery.
For the banding, it's basically a same-day procedure. The sleeve is generally 1 day in the hospital, and the bypass 1 or 2 days in the hospital. In terms of recovery after that, the band is usually about 1 week out of work, sleeve is about 2, and the bypass is about 3. And again, those are averages. Some patients recover a little bit quicker, and some people need a little more time.
The effect of all 3 procedures is that the surgery reduces the amount of food that people can eat. Weight loss is often dramatic.
I had it February 11, 2009, and I think it's like 21, going on 22 months now.
How much have you lost?
330 pounds.
You heard correctly. Elisa has lost 330 pounds since her gastric bypass at Garden State Bariatrics. We interviewed her at Garden State's huge holiday party, in which about 500 patients and their families came together to celebrate their new lives. Elisa was 500 pounds a couple of years ago. One surgeon even refused to take her because her BMI, body mass index, was so high.
So I felt like, oh God, I've waited so long, never gonna be able to get this. I'm just gonna die like this.
Instead, Elisa found Garden State Bariatrics.
It's unbelievable to me. I mean, especially coming from me, I really thought, I didn't think it was gonna work. I thought it was hopeless, that I would just die big like everybody in my family. And the first week I went for my checkup and I lost 30 pounds and I burst into tears. And I was like, oh, maybe it'll be all right. I just want people to know it's possible. You might know somebody that got it and they're not losing that much weight. They're not doing what they're supposed to do. If you follow Dr. Beloff's directions and just live a healthy lifestyle. It's a lot easier when you have this surgery to live a healthy lifestyle. I know at the weight you're at now, it seems impossible to you, but this surgery gives you a jump start and you roll with it, and great things come out of it.
Great things have come to Joe Longo since his bariatric procedure at Garden State. He has lost over 100 pounds.
I weigh 165 pounds now. I haven't weighed this since 30 years ago when I got out of Marine Corps boot camp.
Joe says the weight loss has been great, but regaining his health has been awesome. His diabetes is almost gone. His blood pressure is now perfect.
Some of the health implications, positive-wise to me, are I used to snore terribly, to the point where my daughter would sometimes leave her room and go sleep in the living room. After losing about 20 pounds, the snoring stopped. Because of the diabetes, I was up constantly in the night, going to the bathroom. And after about 25 or 30 pounds, that stopped. And I didn't know probably for 20 years what it was like to have a good night's sleep. And now my wife kids with me that I fall asleep in the middle of a sentence when I'm going to put my head down. I had all those medications, all those 3 different kinds of insulin 3 times a day, all those oral medications. Today I'm on 1 medication because my diabetes is pretty much under control. and the rest of it is just vitamin supplements. And it's been a life-changing experience, and you know, Dr. Billoff will always have a special place in my family's life and my life because, you know, I believe he saved my life.
I urge you to give the great team at Garden State Bariatrics a call. Go in and talk to them. Doctors Billoff and Yersizian are great guys. Their staff is simply the best in the business. They will handle everything for you. They will check your insurance to make sure it's handled. They will do the paperwork with you. It's an easy process. Don't wait any longer. Don't listen to people who know nothing about bariatric surgery. And if you are a diabetic, listen to this.
The amazing thing about diabetes and bariatric surgery is that essentially we've got a cure for diabetes, I think. You know, whether or not you use the word cure or just resolve, basically after this surgery, patients, many patients, you know, with the gastric bypass, we're talking about 80 to 90% of these patients no longer take insulin, no longer take pills, don't have to check their sugars, and when they do check their sugars, they're normal. So in my mind, that's a cure, but whatever word you use for it, they're no longer diabetic. You know, and that's an amazing thing. I often say if tomorrow, you know, Merck or one of the big pharmaceutical companies came up with a drug that produced those kinds of results, it would be on the front page of every newspaper in this country and maybe the world. Yet here we have an operation which does those things, produces those results, and a lot of, you know, the general public, most patients, most people don't know, and even a lot of physicians, quite honestly, don't know.
Thankfully for Santa, Tom Pearson, his doctor did know that bariatric surgery could solve a very serious diabetic problem for Tom. The doctor referred Tom to Dr. Billoff because diabetes was simply killing Tom. He was taking 60 units of insulin, 5 shots a day. The moment he had his gastric bypass surgery, his body responded in a miraculous way. He says he was essentially cured of diabetes.
I stopped 3 days later. They told me to stop taking insulin completely. When I went home, I was off insulin completely. In the hospital, they monitored it a little bit just to try to keep it, to see where it was going. The last day in the hospital, I had none.
The diabetes was gone, and it's still gone. Doctors are not even sure why this happens, but it usually happens fast.
As early as a day after the operation, before they go home from the hospital. They have diabetes when they come to the hospital, they have an operation, they go home from the hospital off of their diabetic medications.
Because their blood tests indicate they can.
Because their blood sugars are normal.
Simply amazing. 53-year-old Newark school teacher Mark Williams had the lap band procedure at Garden State Bariatrics. He lost over 60 pounds quickly and is still losing. His diabetes is also gone. It seemed to disappear the day of his surgery, just like Tom's did. Also gone are the indignities and hassles that come with being a diabetic.
There's so many complications of diabetes. You know, your skin changes colors, and you know, everything's associated to diabetes. And the longer you have it, the worse you become. You know, what do I need a foot doctor for? You understand? So I was going to a foot doctor because I had to be careful of sores and my nails growing crooked and the thickness and the discoloration of my nails. It became crazy.
One of the things that's amazing about this surgery is it cures or treats many different ailments, medical problems. You know, usually when we think about surgery, we think of it treating sort of one thing. You know, you have appendicitis, we take out your appendix. You have a gallbladder problem, we take out your gallbladder. You need your hip fixed, we replace your hip. With this surgery, you can, you know, dramatically improve, if not completely, you know, cure your diabetes. Hypertension, about 50 to 60% of patients are off their antihypertensive medications. Sleep apnea, again, 80 to 90% cure rate or resolution of their sleep apnea. You know, degenerative arthritis, for women, infertility. There's certain cancers that the rate of cancers goes down after this type of surgery. There's just really a whole host of diseases and sort of ailments that are dramatically improved, if not completely resolved, after this surgery.
Now my blood pressure is perfect. My sugar is under control. I'm on no cholesterol medicine, no high blood pressure medicine. I'm on one small dose of medicine for my diabetes. And if it wasn't for the fact that I had type 2 diabetes for such a long time, it's likely that that would have resolved itself and I would need no medication at all. So I traded in all of those prescription drugs for, for vitamin supplements.
It's great. People ask me what I've done. I'm not ashamed to tell them I had weight loss surgery. I know a few co-workers that won't talk about it. They feel embarrassed, like they took the shortcut, and it's not a shortcut. It's a life-saving procedure, and that's how I see it.
John Caldwell was one of Garden State's scores of success stories. He was a college football star who blew out his knee and began gaining weight in school, all the way up to 400 pounds. John finally called Garden State Bariatrics' Milburn office, and that call changed his life.
Well, I went into the surgery that morning that they weighed me. I was 400 pounds, exactly scale was jumping back from 401 to 400. So that was that morning. Today, actually, when I got out of the shower tonight, I went on the scale and it read 241 pounds.
So you've lost 160 pounds?
About 159. The most at one point that I lost was 172.
John has actually gained about 15 pounds from his low, but he's not worried because it's all muscle. And I can tell you, in person, John looks fantastic, muscular, in shape. He works out every day now. Looks like he could run a 4.5 again.
I'm so happy. I'm 100% happy, believe me. He don't snore. He's very active now. He's not losing his breath. It's a lot of good things that came out of it. He eats good, and I was worried about his family history. His mother has passed away from having complications in her health and everything, so I always kept that in mind. So I feel better that he took that surgery very serious and is doing what he has to do to live a long life.
John and Cynthia were in the crowd of hundreds at Garden State's annual holiday party. Portia Beckwith was there, doing the electric slide. Karen Sautner was there, enjoying a wonderful night out with her husband and friends. Karen and Portia were among 4 women who met us one night at Garden State Bariatrics' Milburn office. 25-year-old Liv Aruda of Roselle used to be 270 pounds. On this night, she was 145. She lost 125 pounds after her bariatric surgery. Portia Beckwith of Newark, 56 years old. She once weighed 288 pounds. When we met her, she weighed 176. 112 pounds lost. Karen's sister, April Sinnott, went from 426 to 174. She's lost 252 pounds since her bariatric surgery at Garden State. These 4 women have lost over 600 pounds between them since they had their procedures, since they changed their lives. They are all still losing. Think about that. One of the things that I'd like to start off with is the question that many viewers might have. What got you here? There are people watching this program right now thinking about calling Dr. Billoff, but they won't do it. There was a moment when you all did. What happened? What drove you to call?
I was in the backyard playing with my nephew, running around the yard, and we were playing tag, and it was to a point where I couldn't run after him, and that's when I said, I gotta do something.
Back in 2001, when I was first pregnant with my first child, I was diagnosed with diabetes, and it just kept getting worse, and I figured I had to do something before I wasn't around to see my children grow. And that's after my sister, April, came to Dr. Billoff. That's when I decided I was going to do the same.
What brought me here was when my doctor told me that I was borderline diabetic, and that's something that I did not want to be, a diabetic. And then the weight, I wasn't comfortable. I wasn't happy. It was depressing to be as large as I was.
It was about summer of 2008. I went away. I went to Miami for the weekend, and I took a lot of pictures. And when I came back, I started looking at the pictures, and it hit me. I hadn't taken that many pictures in a while, and it finally hit me, and I started feeling extremely uncomfortable with myself at that point. That's when I looked for Dr. Billoff.
Liv had a lap band procedure. Portia, Karen, and April all had gastric bypass. Insurance paid for the procedures. The weight loss has been dramatic, the diabetes is gone, and they are thrilled with what Garden State Bariatrics has helped them do for themselves.
Having the little kids, they are always on the go. And it was very tough to keep up with them, as April knows. They're very active boys that I have, and it was very tough. It was very hard keeping up with them. And this summer, since my surgery, has been like the best summer ever. We've been going and doing a lot of traveling, and you know, like the water parks that I would just sit and watch everybody. Now I was going and doing.
Able to get in all the rides.
Yes, the water slides and even amusement parks, you know, getting on the rides. When my 6-year-old wanted mommy to go on the roller coaster, and I was like, I had to give him a reason why I couldn't go without, you know. And now this time, just recently, a couple weeks ago, he asked me to go on a roller coaster, and I was like, okay, I'm going. And I did. And it was great. I had a blast.
Now I feel like I'm in my age. I'm 25, I'm living, you know, I'm doing what a 25-year-old's supposed to be doing, and that's been great.
I thought I was very happy, but since losing the weight, oh my gosh, everything has changed. It's so much for the better. I can walk, I was having problems with my legs, so just like you, going up steps, I can run up steps now. I can take walks in the park all the way around and just want to run. I went on to Florida, I went on the amusement rides. I went on a roller coaster that went on upside down 7 times, twice in a row. I went on all the roller coasters, which is like, oh my God. I went on every ride there was. I used to have to go and use a scooter throughout the parks just because I couldn't walk. Now I just can do anything, and everything has just changed, and I feel like I'm 25 instead of going on 42, 43 there, and it's fantastic. Couldn't be better. Life is good.
If life is not good for you because of your